Okay, now we're going to be doing an assessment of the breast. First I'd have the patient pull their gown down to their waist so I could visualize, and ask them if they had any changes or concerns that they were worried about. First thing I would do is look at the breast and see, inspect the size and shape, and skin color and texture. And then I lift the breast and look at the nipples to see if they were symmetrical, if the colors were the same, the smoothness. And I would compare the size of the areola to each other and see if they were the same. I would also notice the characteristics of the nipple to make sure that they were smooth and symmetrical. And then I would also re-inspect this with the patient with their hands behind their head and their elbows bent inward slightly. Then I would also do it with the patients with their hands on their hips with their shoulders lean forward. For the breast, to do check, you do the chest wall sweep. You put the right hand at the right clavicular line and swap down to the nipple until you go all the way out to the outer edge of the breast. And you'd repeat on this side, on the opposite side. And then for the bimanual digital palpation, you put your right hand under the breast and then walk your left hand across. Make sure that you cover the whole breast. And make sure that you're using the finger pads. And then you would do that on both sides. Check for the axillary lymph node. You would have the patient grab the patient's arm and then have them bend their elbow and hold their arm. And then you would palpate under the armpit at the first rib, and then you'd walk it down using the pads of your fingers in downward motion. And then you would also do this until you get to the mid-axillary line where the bra line is. And then the patient's laying down, you would do the three finger, the circle pattern. The three fingers pads down, and you would move them in a circle, starting on the inner, around the areola and working your way out. You could do the vertical stripe pattern where it's up and down, and like an S motion until you cover the whole breast. Or a wedge pattern where you start at the nipple and work your way out like a wagon wheel. And for the areola and nipple, you'd use two fingers and press down on the nipple to make sure that you don't see any lumps or masses. And you would teach the patient to do monthly self-breast exams in the same pattern that you have done, especially after they've taken a shower, or while they're in the shower.